Hi, everyone. Welcome to another exciting episode of Health Talk with Dr. Mo. Like we always promise you, it's a show where we keep it real, relatable, and rooted in facts. Today, we have an amazing guest. So we have someone who is here to tell us all about child immunization. I know a lot of people have questions about child immunization. There are lots of myths about child immunization. So we're going to hear whether these are myths or facts from the guru himself. So with me here, I have a physician, a high caliber person, Dr. Olakule Oladeyin. He's a man of many parts and someone who I've known for many years, who has been part of innovation and impact. He's a visionary leader and technologically advanced person, and he's even working into looking at healthcare technology, which is going to be something very interesting. We're going to talk about sometime. Of course, he has been in GSK for a long time, and now he's retired to do his own thing to add value to the society. Dr. Kule has many years' experience when it comes to child immunization. He has worked across the globe. He has worked in many countries when it comes to child immunization. So he is the best person to give us what exactly we want to know. So welcome with me, Dr. Kule Aladein. Thank you for joining us, Dr. Kule.
Thank you, Dr. Mo. It's nice to be here and a pleasure to see you again. It's been a minute.
Yeah, I know. It's been a long time. Okay, so Dr. Kile, we want to talk about child immunization. I'm sure your ears are full and you know a lot. You've heard a lot working in child immunization. I remember in GSK, one of the things was trying to ensure that every child was immunized, appropriately. And so I would just ask you, first of all, are childhood vaccines safe?
Thank you, Moji. And this first question is a very common question we get all the time. Um, the first thing is that, vaccines are administered to healthy people,
Mm,
so yes, you can understand why safety is very important, as compared to when you apply therapies for people who are ill and need medication. They want to get well. So safety may not be top in terms of the medicines, but now we're talking about vaccines that are being administered to healthy people because you're trying to prevent disease, not to cure disease. So
yeah.
yes, safety definitely will rank top in terms of the profile of vaccines. So the simple answer is yes,
Okay.
childhood vaccines are safe.
Mm,
And I dare say very safe. And simply because prior to getting regulatory approval, either from the FDA, which is the Food and Drugs Administration in the United States,
yeah.
or even the European Medicines Authority, the EMA, and even let's come back home, like in Nigeria, where we have the NAFDAC, who give approval to medicines. Vaccines in particular go through years of rigorous clinical trials. And
Mm,
what we're trying to find during the clinical trials is, first of all, to establish safety. And of course, secondly, will be efficacy of those vaccines. And we
mm,
have a whole lot of different vaccines targeting different diseases. And millions of children worldwide to date have received life-saving vaccines, and we, of course, do collect reports of
yeah.
adverse events,
Okay.
but there is no indication that, certain vaccines are unsafe and should not be administered. Yeah,
Mm,
so
okay.
vaccines are safe.
So now you've established the safety of vaccines, which means that parents, don't be afraid. Go and let your children have vaccines. Now, I'm sure the question on their mind is, why do the vaccines have to be given so early in life? Why is there a routine vaccination for children? Is there any particular reason for that?
Yes, Boji. So in the extremes of life, right? So we're talking of in the newborns and in the elderly, the immune systems are very weak. In the
Mm,
elderly, we call it immunosenescence because, the antibodies are no longer as, active as they would have been in, early adulthood, adolescent life, and the rest of it. Similarly, we see also in young children because they have, of course, initially been harbored in the uterus of the mother before childbirth. And the most vulnerable period in the life of these children is usually the first year of life. And of course, you will need notice that when we look at, childhood mortalities, of course, we're talking about the first 5 years of life,
Yeah.
which again, now I'm trying to extend it. But why is vaccine so important in early life? Is because these children lose their immunity. They are protected by the mother because in the placenta, in the uterus, there's a transfer of, immunoglobulins and for the purpose of your audience, we're talking about antibodies between the mother and the. Now, when the child is born, these antibodies are still in the child, so have been transferred from the mother. So you don't be surprised that the mother's antibodies are protecting the child for the first few months of life.
Mm.
However, this immunity from the mother is passive, it's not active. It wanes off over time.
Okay.
And there comes in the need to still protect these children.
Okay.
And vaccines come in very handy as, the tool to prevent disease. So we vaccinate early because the protection is needed most in that particular age group.
Group. Oh, okay. So
Yeah.
what it means is that, the mother confers protection for the child for just a few months, which is not
Yeah.
actively anyway. So there
Yeah.
needs to be an external immunity granted to the child in order to strengthen their immune system. I think that's what it means. Yeah. And so that leads me to the third questions that can immunization weaken a child's immunity?
I think this is the simplest and the shortest answer I'm going to give on this podcast, and the answer is simply no. Vaccines actually strengthen the immune system because they train the immune system to safely, recognize diseases without causing the disease itself. So when you are not exposed to the germs or the bacteria or the virus, the immune system has the memory due to the vaccines earlier administered and is able to help you take care of that disease. So vaccines, you only use fractions, very tiny, killed bacteria, killed viruses, to stimulate the immune system so that they can recognize these antigens or these bugs, in future if the child is exposed to them. So vaccines actually strengthen the immune system and it doesn't weaken the immune system.
Thank you. Very important. So, what are some of the side effects that are normal after vaccination? Because I remember when I had my kids, when the child goes for some certain vaccination, you have to wake up all night. The anxiety is that, mothers pass this information from one person to another that, if this child is going for DPT, make sure that you have paracetamol, you have this. So, what are the normal side effects that mothers don't have to worry about when it comes to vaccination?
Moji, it's not too long ago that we also recently got vaccinated for COVID. So this is perhaps very easy and it's relatable, we can
Yeah,
tell,
very,
so
very,
usually
yeah.
the common side effects, first of all, they're very mild, these side effects, and they usually resolve very quickly within 24 to 48 hours. So
Okay.
they include pain because we're administering injection. So you're
Mm.
putting a needle into the skin.
Into pain, yeah.
So pain is naturally one of the first and it's usually mild at the site of the injection. So I'm talking about pain or even swelling,
Okay.
just a slight swelling. It could also be mild fever, usually never going above about 37, 38 degrees Celsius.
Right.
Sometimes these kids also could, appear very tired or weak or even temporary loss of appetite. But usually, like I said, these things don't last more than 24 to 48 hours. You should be concerned, and I think maybe we'll have other questions around that, when these symptoms persist longer,
Okay.
than 24, 48 hours. And they resolve by themselves. And if the mother wants, yes, sometimes applying mild analgesics can take care of most of these things I talked about, the pain, the swelling, the mild fever, they just disappear with the use of analgesics, oral analgesics.
Okay. I think you've just incorporated the next question into it, saying that when should parents actually be worried and seek medical help when it comes to a child being vaccinated? At what point should the parents raise an alarm you know.
Yeah. Yeah. I think the first one I said is if these mild symptoms or these mild side effects persist longer than 2 to 3 days, then of course the parents should seek medical attention. But very importantly, even on the first day, okay, you notice maybe the temperature is extremely high, going above about 39 degrees. Sometimes these high temperatures could also lead to febrile convulsions and the rest of them. Of
Mm,
course, then you don't need to be told that you need to seek
big,
medical intervention.
yeah.
Persistent crying, difficulty in breathing, severe allergic reactions. So we've seen patients, babies who have, pustules and allergic reactions around the site of injection, or even far away from the site of injections. Of course, these are reasons why you should quickly seek medical attention. But again, I would say that these are very rare to see after vaccination. It happens, but very rare.
Right. Okay. So the advice you're giving to mothers is that one, you need to have a thermometer at home to check the temperature of the child regularly. And once you see that the temperature is getting to 39, then you need to seek help. And also, if you find rashes around where the injection site is, then you need to raise an alarm, amongst other things that you have said. Is it true that natural immunity is better than vaccines?
So that's a very important question. Natural immunity. So let's first establish the fact that there is natural immunity.
Okay.
Okay. So,
So,
and
for the sake of our audience who are non-medical,
yes,
can you break
yes,
down natural immunity?
yes. Natural immunity means that you have already been afflicted with the disease. Your
Okay.
antibodies have recognized it,
Mm-hmm.
and it is an expensive way to get vaccinated. Okay. It is an expensive way. And the reason why I say it's an expensive way to get
Yeah.
vaccinated is number one, you're going to fall sick because
Mm,
now you are being exposed to the real bug, the real bacteria, the real
mm,
virus that
mm,
causes disease. And then you're going to buy medication, then you're going to be hospitalized. This
mm,
is direct cost. There's indirect cost. If it's a baby, the mother won't go to work that day. She's going to lose
mm.
productivity and the rest of it. Okay. So yes, there is natural immunity, but you get it in a very expensive and unfortunately, in some cases, it could lead to lifelong sequelae, debilitating, um, crippling, conditions, and
Yeah.
even in some cases, death.
Wow.
But then we say you've acquired immunity. But there's also a less expensive and safer and cheaper way to still acquire protection, which is through vaccines. Because in this case, what we put in the vaccine is the killed virus, the killed bacteria antigen, and then we administer it again to mimic, but they don't cause the disease. They actually then train your immune system to prevent this real disease from happening. So yes, there's natural immunity. Okay, I'll give you an example, chickenpox.
Mm.
Okay, so chickenpox is something that, when you have it as a baby, you're not likely to have it again.
Okay.
But
Yeah.
chickenpox management is expensive. Number one baby comes down with chickenpox, almost every child in that house could potentially be
Yeah.
impacted. So you're not having just one chickenpox case, you're having more than one, two
One. Yeah.
cases there, and hospitalization, treatment, and the rest of them. This
Mm,
could have been avoided if you had simply just vaccinated these children, and vaccines do
mm,
work,
mm.
So these are just clear examples of where we say, yes, there's natural immunity, but it's expensive as compared to, the vaccination, which is less cheaper and safer, actually.
Mm. Well said. And in fact, the next question is an interesting one because I'm going to relate it to quite a number of things. Okay. So it is, what are the most common myths about childhood immunization or vaccination that you hear versus what the evidence say? I remember during COVID and when they asked people to go for vaccines, some of the older people, even people that I know very well, learned, said they weren't going to take the vaccine. They want to reduce the world population by vaccination. At least that is one very important myth that I know cuts across all age groups. So, from your experience, what are some of these myths that you've come across, and how can we handle it?
Mojo, I'm sure you're aware that one of the biggest myths around vaccination is that vaccine causes autism.
Ah,
Okay.
yes,
Yes, and, and
yes,
and the reason why I picked autism as the first one is this is not just peculiar to our client. Even in
mm,
North America, we've
yeah,
had world leaders and learned people coming out to, and but we have evidences from large studies that have delayed vaccines from autism. But let's come down to home here, where we've seen apathy in, communities adopting things like polio vaccination because there are rumors that it causes sterilization, in young girls. Again, this is not true. Vaccines do not cause sterilization. As a matter of fact, I'm sure you're aware, Moji, that there are vaccines administered during pregnancy, okay,
yeah,
to protect the
yes,
baby, the unborn baby.
yes,
So vaccines do not cause sterilization. That healthy children too don't need vaccines. If a child is healthy, no, doesn't need vaccines. As a matter of fact, those are the ones who need the vaccines. If a child is ill, we don't
yes,
need to vaccinate the child. As a
yes,
matter, we postpone vaccination if a child
mm,
has a febrile illness and stuff. So it is the well child that, and of course, the last one again is that, the vaccination calendar is crowded. Every year after year, there are newer vaccines making it onto the calendar.
yes,
Um, we, but it's not true. The immune system is trained to
mm,
recognize each vaccine that is administered. Let's pick the pentavalent vaccine. Penta means five, five in one. One single shot is giving you DTP, hepatitis B, and I think Haemophilus influenza type B in
yeah,
one shot. So that is five antigens, five diseases protected with one shot.
one shot, yeah,
And to date, there is no evidence that shows that this doesn't work. So,
mm,
and now we've added additional antigens. There's now the pneumococcal vaccine, the PCV. There's the Rota. There's a cervical cancer, maybe for the young
yeah,
girls vaccine. There's the malaria vaccine, and the antigens just keep coming and coming. And of course, what we're seeing again today is that more children have the unique opportunity to get life-saving vaccines and prevent diseases. So those are the myths that come to mind readily, but the evidence consistently supports that vaccines are safe and effective.
mm. Talking about an important vaccination that you mentioned now, cervical cancer against cervical. Cervical cancer is still ravaging women now, despite the fact that we have vaccines. What do you think are some of the gaps, in people not going for vaccination? And also, I mean, I've spoken about it, I think, in one of the podcast episodes where, we spoke to an oncologist about cervical cancers and all that. However, what people feel is that some people have missed it during that critical time when they were supposed to get it. What is the age they can still get it? So if I've missed it between the ages, the reproductive ages, when you're over 40 or so, is it still possible for you to get it? And what's the efficacy at that point?
Yeah, thank you very much, Moji. So for cervical cancer vaccine, of course, the ideal age is to vaccinate young girls to prevent cervical cancer
Yeah,
before sexual debut, because we know that the necessary cause for cervical cancer is the human papilloma virus, HPV,
yeah.
and HPV is transmitted, during sexual intercourse.
Mm.
Now, once sexual debut when sex has happened, okay, and it is almost likely that at the age of 20, every sexually active woman will have been exposed to human papilloma virus one way or the other. However, that doesn't stop vaccination even after sexual debut. So off the top of my head, we have the cancer-causing strains of cervical cancer, HPV-6, no, HPV-16,
And
HPV-18.
yeah,
Yeah, those are the major ones. And then we have the 31, 35, 52, many other cell types of HPV.
yeah.
So because a patient is exposed to HPV-16 today, doesn't mean that they can still get vaccinated because there are still many other serotypes of the that they can protect against.
Okay.
And I would like to say that these vaccines are not therapeutic. They don't cure existing infections. They only
Mm,
prevent future infections. Don't forget also that HPV has a natural cause. So the key here for cervical cancer is persistent HPV infection. In
mm,
a immunocompetent young lady, immunocompetent means a lady who has, competent immune system, and she gets exposed to HPV. Usually, the system clears it
okay.
because the system will clear it, and everything gets back to normal. But if she keeps getting reinfected over and over and over again, then you see that there's a need to prevent that reinfection with vaccination. So
Right.
because you've been exposed previously, doesn't mean you shouldn't get your vaccine. Now, young girls today are taking 2 doses, and I'm sure that WHO has a position paper where even one single dose of cervical cancer vaccine is capable to protect, lifelong.
No, no.
But in older women, we recommend that they have the complete doses because younger girls respond better. Older women should have, the 3 doses, which is usually 0, 1, and 6 months. Yeah,
Okay. Okay. So it's advisable. I mean, once you've missed it in that age, reproductive age, it's better for you to take the complete good dose
complete
for
dose.
it
Yeah.
to proper immunity. Okay. Thank you for that. That was quite very enlightening. So how can parents tell the difference between credible health information and misinformation online? I would say that the media has become good and bad. There's a lot of news flying around, and now news spread faster in this age than many years ago when we didn't have the phone, the social medias, and all different ways of communication. So, how can people filter what is good and what is bad when it comes to vaccination?
Moji, it's becoming increasingly difficult to even tell what is true and what is not, especially
Mm,
with the advent of AI. Now
yeah,
we see videos on social media that you almost think they are real. And then, of course, luckily now, social platforms are adding the AI, tag
mm,
to content so that users can tell that this is not real, it's AI. If you also think back during COVID, I'm one of those who actually mentioned that the fake news spread faster than
yeah.
the virus itself.
Very true. Very true. I can't number the number of videos you get on fake
Yeah.
news
Do you
is
remember
not.
the one of the teaspoon
Yes,
getting magneted to your skin
yes.
just because you had a vaccine? Yeah. So we just keep educating and enlightening people
Mm,
to be very cautious about, the sources of. If I'm looking for any medical information, I know where to go. Maybe because I'm a medical practitioner. But
mm,
for the general public, I advise them. There are many well-established global portals where they
yeah.
can get credible and science-based backed data. The WHO website is one that is open for everyone. Okay, the
All right.
CDC, the Center for Disease Control in the US, and of course other national health agencies, the NCDC in Nigeria, the other medical bodies, medical sites where you can find credible information. Now, that is where you can find, but I want people to also be very cautious when you see any kind of news that is passing fear,
Mm,
okay, or emotional overtly.
mm.
Be very mindful
An
of the source
alarmist
of that
news.
news. Yes, yes, okay.
Yeah.
Avoid advices that discourage medical care. It's almost unthinkable with the advancement in medical science today. I don't think there should be any voice that should trump over the clear advice to go for medical attention. So any other voice that you're listening to that discourages you seeking healthcare,
Mm,
definitely you should not. And always ask, who wrote this? What's the evidence? Where did you get this from?
yeah.
Always go look for. There are other things to look for. The name of the website, the credits, who wrote it. Are there links that support evidences that support the claims they are making? If you don't find it, what I say to people that if it scares you but doesn't show evidence, be careful, it's not true.
Mm. That's true. Very, very apt. No evidence. It's scary. It's raising an alarm. Most likely, it's just content.
It's not true.
It's content.
It's not true.
Very well said. Thank you very much. So, what diseases have you been seeing that is taking a surge now because people are not being vaccinated, especially children?
Yeah. So would you I want to take this question from a different perspective. I can just go ahead and list diseases that we've seen on BBC, on CNN, outbreaks in schools happening, and the rest of them. But I want people to understand that outbreaks only happen when we fail to break the transmission of diseases. Transmission means in a classroom of kindergartens, 20 kids in a class, a child comes in there with chicken pox. Okay, it's very clear that that child will definitely spread it across that classroom. That's transmission, disease from one child to the other. Okay, and the only way to break transmission of disease, I did not say to break the onset of disease in one child. To break the transmission from one child to the other is to vaccinate a large pool called herd immunity. Okay. Now, it is very easy as humans that when we have an outbreak of the disease, okay, and everybody's also running helter-skelter, kids are falling sick, and then the government says, oh, we need to do mass vaccination, and they vaccinate, and then the disease disappears. It's very easy for us to say, oh, the disease has gone, we don't need to vaccinate anymore, we relax. Why are we vaccinating? Why are we spending so much money? Okay. What you fail to realize is that when you vaccinated a large group of people, what you actually stopped, of course, you protected the individuals that you vaccinated, but you also truncated the transmission of that disease from one person to the other. Once you stop the vaccination, okay, then you transmission is free of any bala, as they say. Then you're transmitting disease from one person to the other.
Moving like wildfire from one person to another.
Yes. Wow. And I can give you examples of diseases that have resurged. The first one is measles. And let me talk about measles. Measles, pertussis, whooping cough. Okay, the moment you stop vaccination, measles has an R naught of about 17 to 18. R naught means one case can infect about 17 to 18 people. Let me give you for context. COVID had an R naught of 3. One COVID patient potentially could spread to 3. Measles has 19 or even up to 20 in some cases, yes. Similarly, pertussis too has a very high R naught. So these are the diseases that will come back faster the moment you stop vaccination. The diseases that transmit very fast from person to person. All you need is one index case. And it just keeps transmitting.
So if you have 5 times 19, so each
multiply it.
20. Multiply it. So in the space of, a few moments, you can 100 people.
Absolutely.
Wow.
Absolutely. And that's the best way I can just explain it. So regardless of the name or the type of the disease, if you don't continue to prevent the transmission, okay, only the few people who are vaccinated will be protected, and then the rest of the community is at risk.
Wow. Vaccination is more important. And now I see why there's a lot of attack on vaccination. Because honestly, if you look at it, what we get to lose if there is no vaccines is more than even all the negative stories that are going on. I can imagine, if there's an outbreak of measles without vaccination now, and of course we know what measles can do to young children, even going to reproductive age, what it can do to them and even cause blindness and all that. So imagine if there are no vaccines for it and it just keeps on spreading and spreading and spreading and spreading. So really, everyone, I think we need to do better when it comes to vaccination. Like Dr. Okunle has said, vaccine is not unsafe. It is actually to prevent transmission. It helps to reduce the amount of people that are infected and to keep people that are healthy continuously healthy rather than harming them. So it's don't be afraid. I think we need to find a way to stop. And the government needs to do a lot when it comes to campaigns, when it comes to education, so that the negative news about vaccines are less or almost non-existent. Because, you know, the way you've explained it now, a lot of people don't even know that. You know, they just look at it that, oh, they're just, vaccine is just one of those things. Oh, the government wants to make money, the government is spending money and all that, you know. So um, let's do better when it comes to vaccination. So my question again is there a way you need to prepare a child emotionally and psychologically for vaccination? I know they didn't prepare us when we are going. Just take us to the hospital. That just we're jabbed against our wheels. Is there anything like preparing a child psychologically and emotionally for vaccination?
Um, well, so it depends on the age of this child. I'm thinking about psychologically, the infants and stuff. But yeah, I get your point, Moji. Yes, regardless of who's coming, don't be surprised that these little babies recognize the hospital environment.
Yeah, white coats.
They know the white coats, they
Yeah,
know the stethoscope,
white
and they
coats.
remember the last time they were here
Yeah,
that something pinched them.
yes, 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 yes.
Yes, yes. So I think the first person to, pay attention to is actually the parents.
Mm,
We need to assure the parents that, yes, you don't want your baby to cry and have, pain at the site of injection, weakness, but we need to also, um, pay attention to the parent. But more importantly, that it's important that we reassure the child, pacify them, or bring pacifiers. Um, I'm not sure if most of the action should be focused on the child, basically, but more for the mother, prepare the mother, the parent properly. Some people even use things like paracetamol before coming
coming,
for
yeah.
vaccination. I wouldn't completely support that. It appears like, the abuse of medication. I
Yeah.
would rather you come for the vaccination, but have your paracetamol handy in case you need to use it. So the vaccination process itself, the act of administering the vaccine,
Yeah.
distraction tactics. We've seen many nice
Yeah.
videos on social media where the physician is very
Yeah.
playful and then the kid doesn't know. Yes, the sight of the needle already, the baby's already struggling because they
True.
remember, you
True.
know, bring pacifiers, make the environment calm. You know, the way our pediatric wards look, they look very inviting and attractive for the young kids. Coco Melon on the iPad somewhere, and the rest of them. Just anything to distract the baby will be
Oh,
yeah,
oh, nice,
ideal.
nice, nice. Thank you. So, what advice do you have for parents who have children with allergies and chronic illnesses? Does this exempt those children from being vaccinated?
Yeah. So most children with allergies or other forms of chronic conditions, these are the people who really need vaccines, especially the children with chronic conditions, because we're calling these comorbidities. They expose them, their immune system is weak
Yeah.
and exposes them to easily fall sick from other infections. So these are the people who actually do need vaccines.
Mm.
Now, if you react to any of the constituents contained in the vaccine, of course, vaccination is prohibited in those people. So what I always advise parents to do, or we ask them, is to inform the healthcare provider of any allergies, if they're allergic to any contents in the vaccine, and then follow individualized kind of guidance. So this is bespoke per patient. If you know the medical conditions of the patient, you can withhold or even advise additional vaccines
Right.
depending on the
Mm.
the condition of the. And I always try to say let's avoid skipping vaccines without medical advice. Don't unilaterally take that decision why the child is not coming to complete a vaccine program simply because of your myth or other conditions. Still show up, get medical advice from the doctor, and then they decide if it's a go or no go.
Right. Wow, wow, wow. Thank you very much. Rounding up very soon, and One question that is very important, and I think this is more when it comes to Africa, because we love to believe myths a lot. How should parents approach vaccination if you have family members that don't believe in it? When when a new couple get married and they have their first child, there's always a lot of pressure, especially in Africa, in the sense that, everybody wants to educate you, everybody wants to tell you, wants to give you their manuals of how you can take care of your child, the best things to do. What would you say in a situation where the mother is being discouraged about vaccination? How can she approach it?
Yeah, but it is a very big issue. And I remember during my public health days, much earlier in my career, um, several questionnaires showed evidence that the father is the final decision maker when it comes to healthcare decisions. And this is not only limited to vaccines. It also includes admissions, blood transfusions, and the rest of them. Okay. But when it comes to medical decisions, I think it should be guided by evidence and not by pressure. Okay. So I will advise that they should have a respectful dialogue in the house. Okay. They must have respectful dialogue. And I think there's also a role for the governments. If we have information and educational materials, disease awareness campaigns, on the radio, on the public transport systems, on the buses, the trains, this already directs the attention of caregivers or say parents or to the existence of disease. Because I've also known in my career that the more severe a disease is, the more likely that people will accept vaccines. Okay. For milder diseases, vaccines may not be seen as an important. So if parents are aware, both parents, male, female, father, mother, of the severity and the epidemiology, and I'm talking about the transmissibility, the outbreaks of a particular disease, these dialogues will be much easier. And they should focus on the child, focus on the child's safety, the well-being of the child,
it's all about the
not
child.
arguments.
Yeah.
Okay, yeah.
Right.
Yes, and last but not the least, they should seek medical professional guidance, if they still don't feel comfortable, if the father is not convinced of the other person, they shouldn't go to the internet because there is a lot of wrong news on the internet. They should seek medical advice and get, yes, the view of a medical practitioner to save the life of that child. Prevention, like they say, is not only better than cure. Prevention is cheaper.
It's cheaper. Thank you. That's my slogan. Prevention is always better than cure. And thank you so much, Dr. Kunle Olade. You've really, really opened our eyes to a lot of things that, has been plaguing people when it comes to education about vaccination. So if you were given an opportunity to change something when it comes to vaccination, or if you had the megaphone and you had just one message to the world when it comes to vaccination, what would your message be?
Thank you, Moji. I think this is like something I've always rehearsed, if I may. Yeah, I've rehearsed this because of my passion for saving human lives. What I always like to tell policymakers, politicians, healthcare practitioners who are not necessarily in the vaccination space, that outside of potable drinking water, vaccines is today recognized as public health's biggest discovery that saves lives. And I'm saying once you remove potable drinking water, that reduces the transmission of diseases. Vaccines, in this day and age, is the biggest public health intervention that we've seen, and we should take it very seriously. Now, Moji, when you look at life expectancy curves across the world, you see in certain parts of the world, it's quite lower than the rest. Now, this is not because when we get to adulthood that our rate of dying is higher? No. Would you know that 25% of our deaths happen before the first 5 years of life?
Wow.
Yes. So because we know that out of every 5 life births in Nigeria, okay, only 4 of them live to see their 5th birthday. And if you add those numbers to this life expectancy, already we've lost the race even before the race started. Okay. And the one way to reverse this mechanism is to make sure that we protect our young children before their 5th birthday. And the best way to do that is making sure that all of them are vaccinated. The last thing I'd like to say is, if you remember at the beginning of this podcast, I did mention that the extremes of life, the young children and the elderly.
Yes.
In other parts of the world today, they've succeeded, they've achieved so much in childhood vaccination and it's on auto cruise. Now they are living longer, okay, in Asia, in North America, in Europe. The older ones are living longer, and now they are now focusing on preventing vaccine preventable disease in the older age group. So vaccines are not only important in younger children, they are also very important in the older age group.
Okay.
And I believe that Nigeria too very soon will be focusing on our elderly, because our elderly will also be living longer, and we need to prevent diseases in those age groups as well with vaccines.
Oof. Wow, wow, wow. What an exciting and an enlightening session. And we just want to say a very big thank you to you, Dr. Olakunle Olade, for sharing your wealth of experience with us in just a few minutes. I mean, I know there's a lot to say, but this is where we're going to wrap it up. And of course, when we get questions from people, because I know there are going to be a lot of questions. Oh, Dr. Olakunle said this. Okay, how do we clarify it? I'm sure we're going to have you again some time to clarify some of this. And on this note, we want to say a very big thank you for accepting to come on the show and sharing your knowledge with us. And of course, viewers, yes, this is another episode to share knowledge. If this podcast is saving just one person, one life, then we have achieved a lot. Am I right, Dr. Kuli? We've achieved something. So please, in order to ensure that the knowledge is not just for yourself, please like, share, subscribe, share it with somebody that needs this knowledge. Like they say, there is no knowledge that is lost. And like Dr. Kunle said, we need to preserve the next generation. The first 5 years of life is very important. And the only way we can safeguard these lives is through vaccination, amongst other things. So please forget all about the myth, forget all about the negativity and all that. Vaccines doesn't cause autism. I need a paper to see that. I mean, Dr. Kuli has said there is no evidence based on, say vaccine causes autism. I've not seen the paper yet. But if you've seen it, you can bring it to us, and I'm sure it will be a nice topic on this episode to dissect it and look inwards and trace it back to other things. So please, if you have children between the ages of 0 to 5, ensure that they have 100% of their vaccines given. And of course, for the reproductive age ones, every age has a vaccine, especially for cervical cancer. We cannot say it enough. Prevention is the cheapest form of medicine. Yes, we are doctors. We need you to come to us to make money, but then we also want you to be alive. So we're doing this. I mean, isn't it interesting to say that we, the ones that need to make the money, are coming to ensure that you stay alive and we prevent it? So that's to tell you that we're not really interested in the money. We just want you to be alive to make the world a better place.
Absolutely.
So, yes, to see you on another episode where we bring you another interesting topic. So we call it a day. Thank you. Bye for now.
Bye, everyone.